Hi, my name is Kamry. So I'm currently a Master's of Business and Science student at Rutgers University, concentrating in drug discovery and development. So a little different from like the MPH programs I know most students are. And I was born and raised in California, specifically Contra Costa County. And so I had the opportunity to work with the county to explore the impacts of telemedicine and how this has benefited the community that I am from. So some areas within Contra Costa County lack reliable transportation options. So I wanted to explore telemedicine and an impact from that standpoint because it's something I noticed growing up there. So studies find that 1 in 5 Americans will miss a healthcare appointment due to lack of transportation. So telehealth provides a promising approach to improving services, especially in underserved communities. This project aimed to, one, evaluate the use of telehealth within Contra Costa County, investigate patient satisfaction and perceptions of this healthcare option, and then explore how um, it kind of impacts patient clinical outcomes. So getting into some of the specifics of the methodology, over the course of this project, 8 healthcare facilities were used in the analysis. Interviews were conducted with physicians, along with 75 additional surveys to gather kind of like professional feedback and some of their opinions. And then after visit surveys were given to over 300 Contra Costa County patients to evaluate kind of their satisfaction and perception of effectiveness and convenience. And then lastly, appointment data was used to analyze the utilization of telemedicine, including frequency of use and the types of encounters. So some of the data showed that about 32% or telehealth appointments and visits accounted for 32% of total appointments scheduled for Contra Costa County Health Services across these 8 different facilities. Of these appointments, mental and behavioral health were kind of the top, being at 33.5%, and medication management types of encounters were about 27%. And then chronic condition management was also notable, being at 19, a little over 19%. Surveys revealed that most patients were satisfied with telehealth appointments, kind of about 87% of a satisfaction rate of those surveyed. Surveys also highlighted similar effectiveness to in-person appointments and overall more convenience. Data from and input from providers indicated like overall increase in appointment adherence by like 27%. And then other benefits included wider accessibility to mental and behavioral health resources, something that's widely used within Contra Costa County, and then lower instances of non-urgent emergency department visits, which I thought was something to highlight, which can help from both the standpoint of having more capacity for people who actually need like emergency attention, and then it just being more convenient for people who can't travel like to the emergency room right away. And so with this being my first time leading kind of like a project and having free reign on like evaluating and gathering data, there are definitely many spaces that I kind of see for improvement. Starting with a smaller pool of data, like collecting all the appointment data from like 8 different healthcare facilities. Sometimes I felt a little lost and a little overwhelmed. And I would like to take a deeper dive into causes of missed appointments to truly tie in that lack of transportation being an issue within this community. Limitations also include reliability and quality of patient after visit surveys. And of course, identifying and following clinical outcomes would require more time and an in-depth research and kind of comparison of patients with similar conditions and treatment plans. There are many more topics as well that can be evaluated to relate lack of transportation to healthcare outcomes. This project aims to highlight how supporting telehealth services is an integral part of accessibility in underserved communities. Data collected can be enhanced and refined to continue to showcase how telehealth is supporting appointment adherence and how this in the long run is impacting clinical outcomes. It could also be helpful to understand and consider any drawbacks. But overall, from this project, I took away that telehealth plays a vital role in accessibility when it comes to areas lacking public transportation infrastructure. And then, of course, the acknowledgements. Thank you to the Future Leaders Program for providing a platform for students like me trying to explore different areas in healthcare and public health as we navigate career paths and furthering our education. So that is the end of my presentation. I know it's a bit short, but of course, I'm open to any questions.